We continue to hear about hot zones of COVID-19 across the country. You may be wondering if it's safe to go out at all. Medical reporter Liz Bonus takes a look at why healthcare providers say we may need to balance risk with responsibility.
Hi. How are you?
Good, how are you?
Good. 97.7.
For weeks, as employees have come to work at TriHealth's Good Samaritan Hospital in Ohio, other employees have been there.
Thank you. Have a good day.
Thank you.
To make sure it's safe for them to show up. But starting soon,
It will be the responsibility of every team member to scan themselves before arriving to work and not arriving to work when they're sick.
in other words, part of your health and safety, no matter where you go now, is up to you.
So that then raises the question, are there places where you might be more at risk of encountering someone with the virus, or maybe a place where you can't avoid the virus? Take, for example, the coffee shop you go every day. Or maybe your favorite bookstore where you like to linger and read a little bit and visit with others.
This chart, recently shared by the Texas Medical Association, says you're at lowest risk of catching the coronavirus in daily activities such as opening mail, at highest risk going to a bar. But in reality, it's not the bar, according to Dr. Kevin Joseph, it's the behavior in it.
All of us, as a community, still have to understand COVID is around.
So take, for example, eating out, going to a movie theater, or going to an amusement park. On this most recent rating, they are high-risk activities. But eat outside, or space out, or don't go out if you feel sick to any of these, and you lower your own risk and the risk to others.
There's a little more research now saying that if you don't have the symptoms, if you're completely asymptomatic, then the chance of you transmitting it to someone else is much, much less.
Dr. Joseph says it's also important for all of us to learn about the virus. Team members at his hospital took training and had knowledge tested before taking on this new responsibility.
Every 14,000 team members had to take that test and make sure they understood how to take a temperature, what the normal range is, and what that means for them.
You see, the virus didn't get the message yet, apparently, that we don't want it to stick around.
It is still going to be here for many more months. Just set up your own practice patterns and habits on wearing a mask, because we're going to be doing this for almost maybe another year.
A year where he says self-responsibility can help lower a risky ride. I'm medical reporter Liz Bonus reporting.